Mr. Chairman, dear colleagues, ladies and gentlemen, good afternoon and good morning to everybody. It's my great pleasure to be here today. And first of all, I would like to thank Dr. Salah for this kind invitation. It gives me a great honor and pleasure to share with you about the focus session that was issued in November 2019 on pediatric endoscopic endonasal skull base surgery. I don't have any disclosures to make. And I would like to thank Professor DiRocco for his idea, actually, because it was someday in 2019 early when we were in the car going somewhere and we were discussing about one case of craniopharayngioma and I was taking his opinion. And then I guess that the idea popped up at that moment and I took the task of doing this by inviting the colleagues and having this group of papers to be published in the focus issue of CNS. So in comparison to conventional microsurgery, one of the greatest advantages of endoscopic neurosurgery is the superior visualization of the pathoanatomy and the higher probability of preservation of the normal structures. And in addition, the use of the endoscope has allowed utilization of unprecedented corridors and making the operations with a new philosophy, something that has eminently been demonstrated in endoscopic skull-based surgery. These new approaches were allowing us to better access many skull-based pathologies and to have a deeper understanding of the relation to the neighboring neurovascular structures. Although the endoscopic endonasal surgery in adult population is becoming an established field. However, still the pediatric counterpart is not yet there. So it was not until the late 1990s when the sporadic case reports and limited series of endoscopic skull-based surgery for pediatric anterior cranial base pathologies start to appear in the literature and to be shared in the publications. Although we have a lot of pathologies in the anterior skull base in children, if we analyze the publications on the subject in the pediatric population, we find that it is still greatly lower than their adult counterparts. The surgical techniques are essentially the same, but in the pediatric populations, there has been a couple of concerns in that regard, which actually hindered the progress of the field in children, mainly the small piriform apertures, the incompletely developed sphenoid sinuses and nasal passages, and also the difficulty with the presumed difficulty with the craniofacial development after doing these surgeries, which has taken the field back a while. Actually, the feasibility of these approaches have been tried and they really worked very well for a very large group of pathologies that start from the most anterior cranial base down to the craniovertebral junction. You can do the surgery for fixation of the resection of the odontoid and treating craniovertebral instabilities, and you still can do, of course, pituitary adenomas and craniopharyngiomas and so many pathologies. So we have issued this focus session in 2019, and it encompassed 10 papers from distinguished colleagues and centers of excellence, in which the whole array of the pathologies that can be tackled through this approach have been addressed. Here is the table of contents of the session. And let me just give you a rapid highlight of these groups of papers. In the first 3 papers, we have a wide spectrum of pediatric lesions that have been treated by endoscopic endonasal route in the 2 publications by Dr. Kim and Dr. Kumas, and also by Dr. Diobojari and his colleagues. They have came across, they just highlighted their experience in the field through displaying a couple of cases I mean, they were not concentrated on a specific pathology. They were rather a bit more comprehensive things, and they were very, actually very informative. For pituitary adenomas, Waltz and colleagues from the Ohio group, headed by my friend Danny Prevedello and Dr. Ricardo Carrao, they presented a review on the pathological entity of pituitary adenomas, and Dr. Lucatelli from Italy, in collaboration with a group of other authors from other places in Italy and in Turkey, they analyzed their pediatric pituitary adenoma cases in a multi-center retrospective study. And Dr. Ghazi Oglu from Turkey also presented their vast experience in treating pediatric Cushing's disease, which is a bit a difficult subject to address. Dr. Drapeau and colleagues discussed the aspect of pediatric craniopharyngiomas, and in another paper from Naples, Professor Capabianca and Luigi Cavallo have spearheaded this group for so many years, and actually they have a great experience in craniopharyngiomas and in meningiomas, and as well as, of course, in pituitaries. But they have provided us with a great, a very nice publication on the lessons learned from endoscopic endonasal surgery for craniopharyngiomas in children. And the reconstruction techniques, which are always one of the main topics in the endoscopic skull-based surgery, and actually one area of great controversy and an area of great importance, because it was considered the big trouble with this type of approach because of the persistent CSF leaks after the extensive exposures. And Libang Yang and colleagues have demonstrated their experience in the pedicle nasoseptal flaps for craniopharyngiomas, and Dr. Shah from the group of Dr. Diopujari have also from India described a broader view with the use of the nasoseptal flaps in very small children in a couple of cases. So in conclusion, I think that pediatric endoscopic endonasal skull-based surgery is here to stay and is expected to grow more in the practice and utilizing more surgical corridors and broader horizons in the near future for treating the little children with pathologies in the region. And I wish that our focus issue has been one of the factors in the flow of flourishing of this beautiful and important and significant surgical philosophy. Thank you very much.